Welcome to Safety Best Practices and Infectious Disease Preparedness, the ninth of 15 video streaming sessions on career and technical education programs for the initiatives for the 2020-21 school year. I am Levita Nutter, Specialist for Agricultural Education and Related Clusters with the Virginia Department of Education's Office of Career, Technical, and Adult Education. We have with us today Ms. Jennifer L. Rose, Virginia Occupational Safety and Health Cooperative Programs Director for the Virginia Department of Labor and Industry, and Mr. Anthony Williams, Curriculum and Instruction Coordinator for VDOE's Office of Career, Technical, and Adult Education. Thank you, Ms. Rose, for joining us today. We appreciate you taking the time to provide our school divisions with important information regarding the actions and procedures required to prevent the spread of COVID-19 and on best practices related to infectious disease preparedness and response plans.
Hi, thank you. I'm glad to be here today to talk about the new VOSH standard on infectious disease prevention and control. Right now, the standard is a temporary standard. The agency decided to take an action once it was realized that this was a pandemic and needed to have some assistance to employers, some guidelines to protect their employees. The standard number is 16 BAC 25-220 if you wanted to look that up in the Virginia State Code. Again, my name is Jennifer Rose. I'm the VOSH Cooperative Programs Director. I have put my email address there. That's probably the best way to reach me if you have any questions about this presentation or after it, any questions that can come up. So why do we have the standard and who does it apply to? Basically, the number one reason for having the standard is to prevent the spread of the virus. And the standard applies to every place of employment within the jurisdiction of the VOSH program. The emergency temporary standard recognizes that various hazards or job tasks at the same place of employment can be designated as very high, medium, or lower risk levels. The standard takes a layered approach to providing employee protection against COVID-19 hazards and job tasks depending on exposure risk level. There are minimum requirements that apply to all employers and enhanced requirements to those in the medium, high, and very high exposure risk categories. And we'll go through all of those four categories as we go along. Some important dates to point out: the emergency temporary standard took effect and went into publication on July 27th, 2020. There are some dates that are included in the standard that need to be pointed out that are important for employers. As of 30 days after the adoption of the standard, which was August 26th, employers are required to provide training to their employees. Any of the medium, high, or very high exposure risk level employees have to have a formal program like a PowerPoint, things like that, whereas the lower employers can just provide the basic information or some sort of oral information required by the standard. The second date that's important was the September 25th 60-day date from the adoption of the standard. And at that point in time, employers were required to have developed and implemented an infectious disease preparedness and response plan. This emergency temporary standard will remain in effect for 6 months. We're looking at January now. And during the 6-month period that the emergency standard is in effect, the Safety and Health Codes Board is considering the adoption of a permanent standard that will replace the emergency temporary standard. There will be a 60-day written public comment period, and one or more public hearings will be held on the proposed permanent standard prior to it being adopted by the Safety and Health Codes Board. So let's talk about how you go about protecting your employees and what actions you can take every day to help prevent the spread of COVID-19. Some common items that are talked about in the standard include social distancing, and this is obviously maintaining a distance of 6 feet from others. And one thing you'll note in the standard is that the standard refers to social distancing as physical distancing, so I'll kind of use the terms interchangeably. You want to encourage self-monitoring of the employees. They should be looking for symptoms, and if they're sick, they should be staying home. Some other protections that the employer can do is to post signs requesting that employees immediately report any symptoms and how they go about doing that. If your site requires any personal protective equipment, you need to make sure that it's being used properly and that employees are aware of how to use it, how to maintain it, and what its purpose is. And while face coverings, they are mentioned in the standard, they are not PPE in accordance with the definitions of the standard. However, they still could be part of your site's plan in providing protections for your employees. Employers should provide access to hand sanitizers, soap, and water, as well as cleaning and disinfecting materials, as well as a cleaning schedule. There is a training requirement included in the standard, and we'll talk more about that in a few slides. And then you also want to make sure that you're protecting employees by not permitting workers that are known or suspected to have COVID-19 to remain at work. And these can include things like not only the employees, but any contract workers, temporary workers, or subcontractors that might be on your site. So what are these 4 exposure risk levels? Lower risk jobs are those that do not require contact inside 6 feet with persons known to be, suspected of being, or that may be infected with COVID-19. These individuals have minimal occupational contact with other employees or the general public, or could achieve minimal occupational contact through the implementation of work practice controls. And one thing to notice, to point out in here, is that the work practice controls are not just the use of masks. These would include engineering controls such as physical barriers or administrative controls such as teleworking. The medium exposure risk level are job tasks that require more than minimal occupational contact inside 6 feet with other employees or persons or the general public that may be but are not known or suspected to be infected with COVID-19. These could include things like waiters, grocery store workers, construction workers, hairdressers, workers in food processing plants, as well as manufacturing workers and construction workers. High-risk job categories are tasks with a high potential for employee exposure within inside 6 feet of those known or suspected to be sources of COVID-19. These include hospital workers, first responders, mortuary service workers, as well as any medical or dental staff. Any non-medical support staff in the industry could also be included under this exposure risk level if they have exposure to those sources of COVID-19. Very high risk category jobs are typically going to be seen only in the medical industry, and they are very high risk jobs that have a high potential for employee exposure inside 6 feet to those known or suspected sources of COVID-19. And these would include employees that perform specific medical procedures that generate an aerosol of the virus, or that they may be doing any lab procedures with specimens from known sources. So how do you determine your exposure risk level? There's several factors involved that help you in determining your risk level. First, you want to look at the tasks that your employees are doing. How close are they getting to other employees? Are they dealing with the public? Are they working in a manufacturing facility, or even if they are teleworking? So you want to first look at what job tasks they're doing. And then you want to look at what environment they're doing these tasks in. Are your employees in an office setting, a classroom setting, or some sort of manufacturing setting? And you will want to look at the presence of the virus. If you had any previous outbreaks, or if you have a high absentee rate due to coronavirus symptoms, you want to make sure that you factor those into your exposure risk level determination. You want to look at the number of employees based in the size of the work area. Do you have employees working in close quarters, or do you have the ability to spread them out and work with social distancing in mind? You also want to look at the duration and frequency of the exposures, things like shifts, and can you work employees on different shifts or staggered shifts such that there's fewer employees exposed at the same time. And lastly, in determining your exposure risk level, you want to look at any hazards encountered that your employees may encounter in the work site, things like contaminated surfaces or other sources of airborne transmission. Some of the training requirements that are stated in the standard apply to very high, or medium exposure risk level employees, where the employees are required to be trained in the hazards and characteristics of COVID-19, and they must be trained by the employer to enable each employee to recognize the hazards of the SARS virus and any signs and symptoms of COVID-19 disease. Employers are required to train each employee in the procedures that they must follow in order to minimize the hazards at their job site. At a minimum, training must include the requirements of the standard, any characteristics and methods of the spread, any risk factors, any awareness of transmission, and safety and health work practices that are implemented in the site. Things like social distancing, disinfecting surfaces, non-contact methods of greeting others. Also PPE, when is it required, what's required, and how do you take it on and off and use it, and as well as its limitations. That's one of the things to point out and make sure that employees are aware of, is that the face coverings that are mandated by executive orders, again, are not considered by the definition of personal protective equipment in the workplace, and therefore they do not provide the same protections as something that may be more protective, such as a surgical mask or an N95 respirator. Some additional procedures that must be included in your workplace prevention program is an infectious disease plan. And the requirements for this plan have to include provisions for sick leave, teleworking, how you're going to inform employees of the policies. This also includes providing them information about the Families First Coronavirus Response Act. And this is the act that allows employees to have sick days, paid sick days in relation to having the COVID virus. Now, while VOSH does not enforce this act, we do require that employers inform their employees of the availability of those provisions. The plan should provide policy and procedures on how employees are to safely self-report and self-monitor any symptoms that they may be having. The plan should include a system for reporting positive test results. Not only how is the employee going to inform the employer of a positive test result, but also in turn how the employer is going to provide that information to other employees at the site who may have also been exposed. The plan should include written return to work procedures, where if an employee is out because of a positive test or because of symptoms, what's your protocol for safely returning them back to the workplace? One of the things that I will point out, that's a requirement in the standard for notification of positive tests. The building or the facility owner must notify all the tenants in the building when there are one or more cases that have been discovered and the floor or work area where the case was located. They are required to keep confidential the identity of the individual, the positive individual, and this is in accordance with the requirements of the Americans with Disabilities Act and any other federal or state laws regarding privacy. The standard requires that employers perform a personal protective equipment hazard assessment. The basics of a PPE assessment are to assess the hazards. How are your employees being potentially exposed to the SARS virus and COVID-19? What protections are you going to be putting into place to protect those employees, be it things like physical distancing, physical barriers, teleworking, staggered shifts, things like that. And then also, any protections that you have in place for the employees, how are they supposed to use them, storage of personal protective equipment or the fit of the equipment. And one thing to point out in the standard, it says that to the extent feasible, employers must provide face coverings to employees that are suspected to be, to employees and or non-employees such as contractors, things like that. They're suspected to be infected with COVID-19. They are required to provide those face coverings until they're able to leave the site. So if you have employees or others into your site that are suspected to be infected with the virus. And this means that person has signs or symptoms of COVID-19, but has not yet tested positive, and there's no alternative diagnosis such as allergies or the flu. Then you must provide face coverings to those until they are able to leave the site. So 7 steps in performing that personal protective equipment hazard assessment. Step 1 is to inform the affected employees of the process. You want to talk with employees in each work area and let them know basically what your process is. You want to make sure that you involve them in that process of assessment because they are the ones that are doing the jobs and would have knowledge of their potential exposures. And second step you want to do is review the data. Have you had any reports of COVID positive tests or near misses with employees having reported symptoms? All this information can provide useful in doing that assessment. Step 3 is you want to conduct a walkthrough survey. And the purpose of the survey is to identify the sources of the COVID-19 hazards to employees. You want to look at things like the layout of the workplace, the location of the employees, any work operations, and any hazards or places where PPE is currently being used. Step 4, you want to determine the hazard risk level. And using those definitions of the four risk levels that I talked about, based on that PPE hazard assessment. And again, those very high exposure risk levels are going to be jobs that are in places of employment with high potential for exposure to known or suspected sources of COVID-19. And then those high exposure risk levels, again, typically in the medical industry, are jobs that have high potential for exposure inside 6 feet to known or suspected sources of COVID-19. Third risk level, medium exposure risk level, again, are jobs that require more than minimal occupational contact inside 6 feet with other employees, other persons, or the general public who may be but are not known to be or suspected to be infected with the virus. Examples of this category would include schools, any high population density work environments, things like food processing or manufacturing, as well as any high volume customer facing retail settings, things like grocery stores, restaurants, and bars. And then those lower exposure risk categories are jobs that do not require contact inside 6 feet with persons known to be or suspected of being or who may be infected with the virus. Some examples of this obviously are teleworkers, any remote workers who are working from home and will not be exposed in the workplace. And the office workers who do not have contact within six feet with coworkers, customers, or the public. These could be because of the layout of the workplace or the job tasks that they do where they wouldn't have exposure to others. In any manufacturing or industrial facilities where workers, again, do not have contact within 6 feet of coworkers or the public. Step 5 in performing the hazard assessment is to determine what controls you're going to put in place to protect your employees against COVID-19. You want to look at engineering controls, administrative controls, and then lastly, any personal protective equipment or face coverings to provide protection to your employees. And all of these things must be documented on a hazard assessment form, which we have provided on our webpage, and I'll give you the link to that at the end. You do want to make sure that you keep this document accessible to not only to at your work site to employees, but also any subcontractors that may be on the site, or potentially any Department of Health or Department of Labor industry employees that may come looking for those. And step 7 is to reassess the workplace as necessary. You know, if all of a sudden you have a lot of employees reporting symptoms, or you have your first positive case, you want to make sure that you're reassessing that hazard assessment that you've done to see if there are any changes that need to be made, or if you've had any new equipment or processes, or change the job tasks that employees do. All those would be examples of reasons why you'd want to review that hazard assessment and potentially redo it. As I mentioned, we do have a template hazard assessment available on our webpage. This is basically goes through those different steps that I mentioned earlier. First, you want to do a basically a line item for each job task or job category that employees are doing. These could also be simplified and whittled down further into specific employees. What if you have one specific employee that's doing a job task that maybe not others in that job category could be doing, you'd want to have a line item for those. But typically what you're going to do is look at each of the job tasks that your employees are performing and write those on the as a line item on the assessment. You want to describe the hazards involved in that and where their potential for exposure would be. And from there, you want to use those definitions of the 4 exposure risk levels and document which level those certain tasks are related to. Then you want to look at what sort of controls are you putting in place. Things like physical distancing, physical barriers, teleworking, staggered shifts, face coverings. Again, all those protective controls that we've talked about before. One thing to note is that you may have a job category of employee who may, let's say, be in a lower exposure risk level, but on occasion, they do a job task that would then bump them up into the medium exposure risk level. You'd have to have an additional line item for that specific job task. So again, job tasks or even at a work site, you could have various levels of exposure risk level at that one site or in one department or division. So we're going to talk about another control of social distancing. Again, the standard refers to this as physical distancing. Employers need to ensure that employees observe physical distancing at all times on the property, and this should include policies and procedures that use verbal announcements or signage or even visual cues to promote physical distancing. The employer should work to decrease worksite density by limiting non-employee access to the place of employment or potentially restricting access to only certain work areas to reduce the risk of exposure. You want to look at physical distancing in common areas, things like break rooms, bathrooms, and lunchrooms, and the need for either closing those or controlling occupancy in those areas. Some things to point out with the common areas is that employees are required to clean and disinfect the immediate area in which they were located, or the employer may do this and provide cleaning and disinfectant spray for employees that are designated as cleaning that, or for anyone that uses that break room or lunchroom. Make sure that they're being cleaned and disinfected at regular intervals. In addition to the physical distancing requirements, those common areas, you want to make sure that employees are provided with either soap and water for hand washing, or when that's not available, you want to provide them with hand sanitizer. Speaking more on common areas, the standard requires that each employer posts something, a notice at each common area, and the notice has to include the 4 things listed there. You have to include the occupancy of the space, such as, in order to maintain those physical distancing requirements, potentially you could have to reduce your occupancy in that lunchroom to half, or however many employees you determine in order to maintain that physical distancing that would be allowable in that job work site. It should include a reminder to physical distance and things that could be controls that could be in place to work alongside this would be things like skipping not allowing employees to work in every other sitting in every other table or bench area. You want to look at reminding employees of washing their hands and sanitizing their hands. And then you also want to include in that notification some your process for cleaning and disinfecting shared surfaces. Again, are you expecting employees to do that prior to them sitting down or after they've used the area, or do you have one dedicated person who goes around and cleans those common areas on a frequent, regular basis? When I talk to cleaning and disinfecting shared surfaces, Some of the infected surface or the high touch areas that you want to consider obviously are things like light switches, doorknobs. Some of the other less commonly thought of high touch areas would include things like vending machines or stair rails, anything that you have the potential for lots of employees or the public touching that do need to be included in that cleaning and disinfecting process. What I've listed there is the EPA webpage. They actually have a list of registered pesticides that can be, or disinfectants that can be used to effectively prevent or limit the SARS virus or the COVID-19. The last thing I'm going to talk about the requirements for the infectious disease preparedness and response plan. Employers in the exposure risk levels of very high and high must develop a written infectious disease preparedness response plan. Those medium exposure risk levels with 11 or more employees must also develop and implement a written plan. The plan and any training requirements tied to the plan will apply to those employees classified again as very high, high, and medium. Employers must designate a person to be responsible for implementing that plan. And this could be a line employee, a safety director, or someone in top management. The written plan must include the name of that individual that is responsible for administering the plan. And ideally, this person should be knowledgeable, obviously, in the work tasks that are involved at the employer site, but also not have basic knowledge of infection control procedures and any practices as they apply to your site. The plan must also provide for employee involvement in development and implementation. Again, just like with the hazard assessment, you want to make sure that you're involving employees in this process because obviously they are the ones who have the intimate day-to-day knowledge with the job tasks that they are to be performing. The plan should consider and address the levels of risk associated with various areas in the workplace and any hazards that employees are exposed to with the job tasks that they perform at those sites. The plan must contain where, how, and to what sources are employees exposed to the virus or COVID-19. These can include contact with the general public or customers or other employees, students, or other faculty at your job site. These also could include any known or suspected to be infected persons or those at high risk categories. Again, things like patients in hospitals. And I'll mention again situations where employees work more than one job with different employers and can encounter hazards or engage in job tasks that present a very high, or medium level risk level exposure, who are typically would be classified as that lower exposure, but you can have those dual employees or job tasks. And the infectious disease preparedness and response plan must also include provisions for engineering, administrative, work practice, and personal protective equipment that will be necessary at your job site to address those risks. The employer's written plan should also take into consideration a contingency plan for situations that may arise as a result of outbreaks at the site. These would include things like an increased rate of employee absenteeism, the need for physical distancing or staggered work shifts, or even downsizing and delivering services remotely. The plan should include, the contingency planning should include options for conducting essential operations with a reduced workforce if necessary, or including cross-training employees across the different jobs in order for the employer to continue operations, but with that reduced workforce. One also thing you want to consider with contingency planning is if you have any certain products or services that may come in that potentially could be delayed because of the coronavirus. And so you want to look at any potential for interrupted supply chains or delayed deliveries that may impact your work site as well. Plan must include basic infection prevention measures that are to be implemented at your site. These would include things like promoting frequent and thorough hand washing, including not only by the employees, customers, students, visitors, the general public, to your place of employment and just making sure that they are aware of what procedures you have in place. And if soap and running water are not immediately available to them, then you do need to provide hand sanitizers. The plan should include how you're going to maintain regular housekeeping practices. And this will include routine cleaning and disinfecting of any surfaces, equipment, or any other elements of the work environment that could be contaminated. And the plan should include policies and procedures on how you're going to manage and educate visitors to your place of employment. While they won't need the full training like your employees would, including like a classroom training or virtual PowerPoint presentation, visitors must at a minimum be made aware of what the requirements are for them when entering your job site. Things like, are they required to use a hand sanitizer? Do you perform temperature checks? Are they required to wear face coverings? All those things, whatever you have in place at your job site, you want to make sure that any visitors to the site are following those requirements as well. The written plan to provide for the prompt identification and isolation of known or suspected to be infected with employees, including procedures for, again, how they're going to report those experiencing symptoms to you. And the plan should also include address infectious disease preparedness and response with any outside businesses, again, subcontractors or businesses that provide or contract temporary employees to the job sites. They need to be considered in your requirements and included in the written plan as well. And one of the last requirements and provisions in the standard for the infectious disease preparedness and response plan gives employers the ability to use and follow CDC guidelines in lieu of the requirements of the emergency temporary standard. If they are to follow this, they are required to be able to identify those mandatory and non-mandatory recommendations and include their source of where they got that information from the CDC guidelines. Employers must also ensure that they are in compliance with any mandatory requirements that may be above and beyond what's required in our standard of any applicable Virginia executive orders or any public health emergency related orders from Department of Health or other sources. So that's all that I have. It was a lot of information. The text of the standard is available on our webpage if you're interested in reading that. But I've tried to break it down into smaller chunks for you to have it be a little more digestible. One of the things that I do want to promote is the VOSH consultation service. It is a free service offered by our agency where at the request of a small employer, which is employers that have 250 employees at their job sites or less than 500 corporation-wide, they can request a consultant to work with them for things like help with developing their written COVID-19 response plans or provide training to their employees. Any of those different requirements of the standards that our employees, our consultants can provide help to you on working through those and making sure that you are in compliance. If you did want to request a consultation visit, that first link there is a link to the consultation page. It talks more about the program and what's involved, and then it also has a request form that you can fill out and turn in to us. Again, my email address is listed on there. We also have a dedicated COVID-19 questions email address, which is staffed by several of our management employees. So you're pretty much guaranteed to get a quick response on emails to that COVID-19 questions email address. All of the information that I provided, things like the templates, the PowerPoint presentations for training, or the template for the infectious disease preparedness and response plan are all available on our webpage. The front and center of the dolly.virginia.gov webpage, there is a link for coronavirus resources, and on there, again, that's where you find downloadable forms and templates that you can use to implement all the requirements in your workplace. And then I do have the last link has recently changed. If you do have 3 or more positive cases at your workplace, you are required to report that not only to Department of Labor and Industry, but also to the Department of Health. And in order to do that, we have a electronic portal on our webpage that employers can go in and provide us with all the information that we need to make sure that we've identified that your workplace has had those cases. And filling out the portal does not only notify us, but it also meets the requirements of notifying the Department of Health, because the two agencies are working closely together to ensure that employees are protected and in compliance with our regulations. So that's all I have today. Thank you for the opportunity to talk to you about this very important standard.
Thank you, Ms. Rose. We appreciate you sharing this valuable and important information with us. Now we are going to discuss safety best practices in labs where students are involved with using tools, equipment, and machinery, and recommend taking the appropriate steps to mitigate any dangers and risks to students, instructors, and visitors to provide for a safe learning environment. Safety best practices are applicable to every CTE career cluster, and for additional information, the Safety Guide for Career and Technical Education can be referenced to provide examples of best safety practices for school division administrators and career and technical education teachers. Safety is never an accident. Safety always takes precedence over all other considerations. Keeping classrooms and laboratories clean, safe, and orderly is the first step in mitigating any safety issues that may arise. Regular cleaning and maintenance of classrooms and labs should be an integral part of the program's best safety practices to ensure the well-being of students and others. An organized and clean lab environment encourages a safe, positive workplace environment for learners, increases efficiency, and helps to prevent accidents. All safety and sanitation principles and protocols must be followed. All chemicals must have locked storage, and safety data sheets must be maintained, visible, and immediately accessible. Teachers are to deliver all safety instruction applicable to the competency or task, and ensure that students take all applicable safety tests prior to using any tools, machinery, or equipment, or engage in any activity that requires prior safety instruction, given exposure related to chemical, physical, electrical, mechanical, or other hazards. Students must achieve 100% accuracy on all safety tests. It is highly recommended for instructors to use student, parent safety information forms or contracts, and all students should be instructed on classroom and laboratory safety rules and practices and procedures for reporting an accident or injury. Ensuring students understand and adhere to safety protocols and procedures protects the learner, the instructor, and all involved in the learning activities. Students should be instructed on the hazards they may encounter based on the courses they are enrolled in. For example, students working with livestock need to be instructed on the hazards of animal handling, working with livestock in confined spaces, crush hazards, animal handling facilities, escape routes, biological hazards. Personal protective equipment, commonly referred to as PPE, is equipment worn to minimize exposure to hazards that cause serious injuries and illnesses. These injuries and illnesses may result from contact with chemical, physical, electrical, mechanical, and other hazards. Personal protective equipment may include items such as gloves, safety glasses, shoes, earplugs or earmuffs, hard hats, respirators, or special clothing. Personal protective equipment must be worn to minimize exposure to hazards that can cause serious injuries and illnesses. To ensure the greatest possible protection for students in the learning environment, educating students on when PPE is necessary, the importance of selecting and using the appropriate PPE, how to put on the PPE, how to take off the PPE, adjust and wear the PPE, and the limitations of the PPE. Students should also be instructed how to properly care for and maintain the PPE, the useful life and proper disposal of the PPE. All of this will help in establishing and maintaining a safe and healthful learning environment. OSHA requires employers to ensure the safety of all employees in the work environment. Eye and face protection must be provided whenever necessary to protect against chemical, environmental, radiological, or mechanical irritants and hazards. This requirement is the same for our teachers and students in the learning environment. Eye and face protection is a requirement and must be provided. Determining the need to provide hearing protection for students can be challenging. Exposure to excessive noise depends on a number of factors, including the loudness of the noise as measured in decibels, the duration of each student's exposure to the noise, whether students move between work areas with different noise levels, where the noise is generated from one or multiple sources. When in doubt, use hearing protection. Planers, joiners, abrasive cutoff saws, and grinders, just to name some equipment found in our educational labs, make very loud noises, and prolonged exposure to this noise could cause damage to hearing. Students who face possible bodily injury of any kind that cannot be eliminated through engineering work practices or administrative controls must wear appropriate body protection when performing laboratory activities or their jobs. In addition to cuts and radiation, the following are examples of lab and/or workplace hazards that could cause bodily injury: temperature extremes, hot splashes from molten metals and other hot liquids, potential impacts from tools, machinery, and materials, and hazardous chemicals. There are many varieties of personal protective clothing available to protect students from specific hazards, and students are required to wear personal protective equipment for the parts of the body exposed to possible injury. Examples of body protection include laboratory coats, coveralls, vests, jackets, aprons, surgical gowns, and gloves made from metal mesh, leather, or canvas to provide protection against cuts and burns. Leather and canvas gloves also protect against sustained heat. Appropriate disposable gloves should be worn to protect against biological and chemical contamination. Respirators protect students from harmful dusts, fogs, smokes, mists, gases, vapors, and sprays. These hazards may cause a number of illnesses and ailments and impairment diseases, or even death. Compliance with OSHA respiratory protection standards is critical. Instructors should ensure the use of fume hoods for all operations involving harmful gases or fumes and for flammable or explosive materials. Inspect the hood to ensure it is working properly and ensure it is inspected annually. Make sure dust collection systems and laboratory exhaust fans are working properly to protect against fire and explosions and to enhance safety, air quality, accident prevention, efficiency, and to protect the learner in the learning environment. Students working in mechanics laboratories, to include auto mechanics labs, auto body labs, heavy equipment and machinery, working with livestock, working in landscaping, who may face possible foot or leg injuries from falling or rolling objects, or work that involves exposure to hot substances or corrosive or poisonous materials must have protective gear to cover exposed body parts, including legs and feet. If a student's feet may be exposed to electrical hazards, non-conductive footwear should be worn. On the other hand, exposure to static electricity may necessitate the use of conductive footwear. Examples of situations in which a student should wear foot and leg protection include when heavy objects such as barrels, tools, equipment, or machinery might roll onto or fall on the student's feet. Working with sharp objects such as nails or spikes that can pierce the soles or upper of ordinary shoes, exposure to molten metal that might splash on the feet or legs, or working on or around hot, wet, or slippery surfaces, and working with electrical hazards. Unattended equipment and reactions are major causes of fire, floods, and explosions. Be sure that all utility connections are secure and anticipate hazards that will result from failure of electrical, water, or gas supplies. Be sure that moving parts of mechanical apparatus are guarded to prevent hazardous contact. Never remove guards from machinery unless it is being replaced, and never operate tools, equipment, or machinery without their required guards. Food products such as lunches, snacks, juices, and condiments are not to be stored in laboratory refrigerators, and consumption of food and beverages or smoking should never be permitted in laboratory operation areas. Livestock, veterinary science, and small animal care courses where students work with animals present hazards for zoonotic diseases. Instructors and students should always wash their hands after being around animals, even if they did not touch the animals. Ensure that all protocols and safety procedures for eliminating any biological or chemical contamination are being used. The Veterinary Science 1 and 2 courses have a special note stipulating that the course has specific state laws and regulations from a governing medical board or agency, and to please contact the Virginia Department of Education's Office of Career and Technical Education prior to implementing the course. The statement simply means that the course competencies in the course that are related to personal protective equipment, sanitation and sterilization, animal facilities and housing, animal handling and restraint, animal feeding and grooming, animal bites and scratches, zoonotic diseases, and biological and chemical exposure are directly related to the standards, procedures, protocols, and regulations that are set forth in the laws governing veterinary medicine and by the Centers for Disease Control and Prevention, and they must be followed to protect the health, safety, and welfare of the students, instructors, and animals. Should you have any questions or need further clarification or assistance, please contact the Office of Career, Technical, and Adult Education. Our contact information is provided at the end of this presentation. I will now turn this over to Mr. Anthony Williams, the CTE Curriculum and Instructional Coordinator for the Office of Career, Technical, and Adult Education.
The Virginia Department of Education, Office of Career, Technical, and Adult Education is pleased to offer the OSHA Authorized Trainer courses. Successful completion of the construction and general industry trainer courses enable instructors to teach the OSHA 10 and 30-hour training programs. The OSHA 500 Construction Industry Train the Trainer course will be offered December 8th through the 11th. The OSHA 511 General Industry Standards course will be offered November 17th through the 20th, and the OSHA 501 Train the Trainer course will be offered December 14th through 17th. All courses will be offered virtually and facilitated by West Virginia University faculty. Pre-registration is required. A special thanks to Jennifer Rose and Levita Nutter for their part in today's presentation. Archived video sessions are available on the VDOE website on the professional development page. For questions regarding today's video session, please contact Anthony Williams at cte@doe.virginia.gov. Please take a few minutes to complete the evaluation for today's session. You can access the evaluation form by going to the professional development page and clicking on today's session, or by using the link on the slide. The next video session will be aired on December 3rd, 2020, and will explore virtual learning in a CTE environment. I hope the information that we have provided you today will be helpful as you plan for the upcoming semester.